19.
Usually I'm farther back. Can I use that as a focal point? Where should I use it as a focal point? Just on curiosity, because usually I'm farther back. Just still here. So usually I'm farther back and I use that as a focal point. Well, it doesn't matter, does it? Okay.
Good morning.
Good morning.
Whatever.
All right.
Should come to a vaccine clinic. There's a lot of people there.
The Ramsey County Board of Commissioners meeting is called to order. Will the clerk please call the roll?
Fretham,
Here.
Matas Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt,
Here.
Carter.
Here. Thank you very much. Commissioner McDonough, Commissioner Ortega, would you please lead us in the Pledge of Allegiance while we all mute?
I pledge allegiance to the flag of the United States of America, for which it stands one nation under God, indivisible, with liberty and justice for all.
Thank you very, very much. We have before us the agenda of January 12th presented for your approval.
Move approval.
Second.
Thank you very much. There is a motion and a second. Any discussion? Will the clerk please call the roll?
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Carter.
Aye, thank you very much. The agenda has passed and the minutes of our January 5th meeting are before you. Is there a motion?
Move.
So moved. Second.
There is a motion and a second. Any discussion on this item? Clerk, would you please call the roll?
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Carter.
Aye, thank you very much. And the minutes of January 5th have passed. We have guests in our courtroom this morning, and those guests are here for a special proclamation. The proclamation is in celebration of the Karen New Year. And I would like to welcome then to the front, and I assume they're already there.
Madam
Prince-
Chair, we have guests virtually in the courtroom with you today on
Yes.
Zoom, but not in the courtroom specifically physically. So they're with you on the.
Yes. Thank you very much. So I would like to welcome to our meeting together with us Prince Corbett, our Racial and Health Equity Administrator at Ramsey County, and Ameya, Social Worker at Ramsey County, and Atak Hu, Co-Executive Director of the Karen Organization of Minnesota, while also then turning to Commissioner Fretham to present the proclamation in honor of the Karen New Year. Commissioner Fretham.
Thank you so much. Yep. Sorry, we have a frozen iPad game. It's terrible. Welcome. I can't help you right now, honey. I want to welcome Prince and Ameya and Etakaku as well. Thank you all for being here. We are thrilled to honor the Karen New Year with you all. I will read the proclamation, and then I hope you're able to say a few words for us. So whereas Karen families began arriving in Minnesota in the early 2000s as political refugees, seeking asylum from the oppressive rule of the Burmese military dictatorship. And today, Ramsey County is home to one of the largest Karen communities in the United States. And whereas the Karen New Year, which was first officially recognized in 1938, formerly the 2677 year on the Karen calendar, is celebrated on the first day of Piato on the lunar calendar, typically occurring at end of December or beginning of January. And whereas the Karen New Year marks the end of harvest of one rice crop and the beginning of the next rice crop, and also marks the building of new homes. And whereas the Karen New Year is the most recognized holiday in the Karen community, which includes the Karen Dawn dances, Karen bamboo dances, singing, and plenty of feasting. And whereas the Karen New Year helps to preserve Karen culture, traditions, relationships, and trust among community members, it enables Karen people to feel pride in their heritage, and it creates an opportunity for Ramsey County communities to learn about and enjoy the Karen culture. Now, therefore, be it proclaimed, the Ramsey County Board of Commissioners declares January 13th, 2021 as Karen New Year Day in Ramsey County. And be it further proclaimed, the Ramsey County Board of Commissioners encourages communities to celebrate the Karen New Year by learning about Karen history, committing to cultivating improved cultural understanding, developing relationships, and supporting our Karen neighbors in Ramsey County and beyond.
Thank you very much, Commissioner Fretham, for reading the proclamation in celebration of this day. And I'd like to turn to our guest for your comments. We appreciate having you here, knowing that our two Ramsey County employees have worked together and with the Karen Organization of Minnesota to write this proclamation and to bring it before us today. I'll turn to our guest. And I'm not sure who's leading, but I'm sure you do know. Thank you.
Thank you, Madam Chair. I just wanted to share, I'm Prince Corbett, Racial and Health Equity Administrator, and it really has been an honor to work with Ame on this proclamation. And I yield the time for words from Ame and Etaku, and I'm just humbled to be a part of this.
Thank you very much, Prince. And Ame, are you there also, along with Etaku?
Yes. Good morning, County Commissioners and everyone who are presented in the courtroom today. I am very honored to be here this morning. Thank you very much for acknowledging the Karen New Year Day. I am Ameya with Ramsey County Social Service. Also, thank you for recognizing the Karen community. It is very encouraging for my community to be acknowledged and given recognition we have not previously received. As you may or may not know, the Karen people have come to Minnesota as a refugee population due to the continued civil war in Myanmar. This ongoing genocide has caused the relocation of the Karen people throughout the world. Ramsey County, Minnesota has now become one of the largest population centers for the Karen people in the United States of America, with a population estimated around 17,000. The Karen started to come to Minnesota in the early 2000s. I know that our time here has been brief, but we Karen are working towards building a better future for ourselves in Ramsey County. Through active engagement between Ramsey County and the Karen people, we are able to begin to grow together and establish bonds that will allow us to prosper. The recognition that we are receiving today reinforces the efforts that we are making towards gaining acceptance in our new environment. This is another step in our journey, and while it is a meaningful step, it is not an end. The Karen community will continue to grow, learn, adapt, and evolve. We will continue to display our culture, our history, and our heritage. The recognition of the Korean New Year Day by Ramsey County shows that we are accepted and respected for who we are. Once again, I would like to thank you. Stay safe, be healthy, and well in the new year.
Thank you very much, Ahmed, for representing the history and the experience before us today. We appreciate it. And we also know that Etaku is there with you. So we will ask her, Etaku, to join us and speak.
Thank you for having me this morning. First of all, I'd like to thank the leadership of Ramsey County for issuing the proclamation recognizing tomorrow, January 13, 2021, as Korean New Year in Ramsey County. I also want to thank Mayor and Prince for initiating this and brought it to the county manager attention. As the mayor said earlier, Minnesota has the largest Korean population in the nation, and within Minnesota, Ramsey County has the largest Korean population. We are very grateful for this recognition and the partnership we have with Ramsey County and other capacities such as civil engagement, COVID-19 testing and tracing, and we used to have Ramsey County financial worker who came out to our office to serve our community twice a month before the COVID started. Once again, from the bottom of my heart and on behalf of the Korean community, I sincerely thank each and every one of the leaders for issuing this proclamation, recognizing January 13, 2021 as the Korean New Year in Ramsey County. Happy New Year to you all. Thank you very much.
And thank you so very, very much for being here with us. You see all of the hands going up and recognition, celebration, and appreciation for your presence here with us, and also for the opportunities that we have to connect with the Karen community through the Karen Organization of Minnesota. We thank you for coming forward, for being a partner with us, in particular through the work that we've been engaging in this past year. Thank you so very much. The one question I have, and then I'll open up in case others would want to check in with you, and I do see that there is at least one hand, is are there ways in which we can engage this year that you might share with us? The Karen holiday, the New Year holiday, is one that allows us to connect and learn about the community. And this year, it is so difficult. Gatherings, of course, not large gatherings not happening. But are there links that you can share with us today or later that would allow us to connect in?
Sure, yeah, we are celebrating our Korean New Year tomorrow, actually, at 10 a.m. Virtually. We have a event page that already created in our KOM YouTube channel. So I'll be more than happy to share the link right after our meeting here. I will send it to you, Tony, directly, and also to Prince and Amia, so that you can pass it on to other leaders who may interested in joining us.
Well, we thank you very much for that invitation. And I do have a couple of hands, well, one hand up, Commissioner Matis Castillo.
Yes, thank you, Madam Chair. I wanted to wish you a very happy new year at Taku and Ame, yeah. It is, as someone who has a lot of Karen members of the community in my district, I just want to say it is such a delight to work in partnership with KOM and other Karen organizations. And for anyone who might be watching and listening, you know, this is a culture that is very giving and collaborative and really engages in partnership. And so I would encourage you to get to know KOM, get to know your Karen neighbors, visit one of the new businesses, small businesses and restaurants. There's a tremendous asset to our community, and we are really grateful that you are here and that we can celebrate alongside you in this Karen New Year and strengthen our partnership together. So just wanted to give a great shout out to the Karen community and Happy New Year to you.
Thank you very much, Commissioner Matis Castillo. Commissioner McGuire.
Thank you, Madam Chair, and I'm just going to add my congratulations to the rest of the board and Commissioner Matis Castillo to the Karen community. I know that you're interspersed throughout Ramsey County, but we are proud to host many of your headquarters and organizations in Roseville, and we love working with your community on the things that make it so vibrant. And so just thank you so much for your contributions to the community and your work to really make us a great community where we can all thrive. So just congratulations on your new year. I'm sorry we can't do it in person. It's a spectacular event in person, but hopefully I will be able to get on YouTube tomorrow and watch and celebrate that with you. But just congratulations and thank you so much for being such a great part of our community.
Thank you very much, Commissioner McGuire. I know that you will hear the same as you have opportunity to connect in with each commissioner and with all of Ramsey County and also with our community. Thank you so very much for being here with us to recognize and to show appreciation for the celebration of the Karen New Year. Blessings for your holidays.
Thank you.
And if there are any final comments, we certainly want to make sure not to conclude before we hear them. All right. Thank you so very much for being here with us. Once again, we are fortunate to have the Karen community here with us in Minnesota, and we look forward to any of us and others who will be tuning into the YouTube channel and helping to celebrate tomorrow. Thank you, Commissioner Fretham. I will pass on then to our county manager for our COVID update. County Manager O'Connor.
Thank you, Madam Chair and members. I'm going to turn it over directly to Public Health. We have a comprehensive update today on many different fronts, and I'll turn it over to Deputy County Manager Kathy Hedin.
Thank you, County Manager O'Connor, and thank you, Madam Chair and Commissioners. We'll take a look at the dashboard for a situation update. Today, we'll review Governor Walz's loosening of the restrictions, and then I'll hand it over to Medical Director Lynn Ogawa and Public Health Protection Manager and Incident Commander Laura Anderson for a COVID-19 variant and vaccine update. So to the dashboard, we will look at Minnesota. Cumulatively, 437,552 people have been confirmed positive for COVID-19. There have been 22,815 people hospitalized to date, with 686 hospitalized as of yesterday, and 4,783 people who have been in the ICU, with 141 in the ICU currently. Unfortunately, we've lost 5,711 people in Minnesota to COVID-19. We will move over to the Ramsey County dashboard. 39,051 people have been confirmed positive to date, and unfortunately, we have lost 707 people to COVID. We continue to monitor the cumulative cases and watch for trends within Ramsey County. As you can see, new cases are still appearing to be higher than they were during the peak last spring. So we remain vigilant, continue to social distance, wear masks, and pay attention to symptoms and stay home if you are sick. If we look at the case rates, all of the Metro County cases or case rates have dropped dramatically since November, with Ramsey County sitting at 15.3 cases per 10,000 residents, and our positivity rate is also down at 4.4%.
I want to just check in. I wonder if you believe that we are seeing the dashboard information. We are not. So I just wanted to make certain you were aware of that. Oh, there it is. Thank you.
Perfect. Thank you for letting us know. We do encourage you to continue to get tested if you are experiencing COVID-19 symptoms. If we want to move over to the testing site, saliva testing continues to be available through home tests or through multiple sites in Minnesota, including Roy Wilkins Auditorium next to the St. Paul River Center. Testing occurs every day of the week. And again, you can get this information as well as get to our dashboard at ramseycounty.us/coronavirus. Quick update on the governor's restrictions that were loosened beginning yesterday. Indoor dining at bars and restaurants opened at 50% capacity with a maximum of 150 people. Establishments must close dine-in service by 10 p.m. Gym capacity remains capped at 25%, but maximum capacity increases to 150, and classes can increase to 25 people, assuming distancing can be observed. Face coverings continue to be required. Outdoor events and entertainment continue at 25% capacity, but maximum capacity increases to 250 people. Social distancing is still required. Indoor events and entertainment like bowling alleys, movie theaters, and museums can open at 25% with no more than 150 people in each venue. Youth and adult organized sports resumed practice last week, and games resume this week, January 14th, with spectators, depending on rules within the organizations and areas that those games will be played, following the appropriate capacity limits for indoor and outdoor venues. Inter-region tournaments and out-of-state play are discouraged. And places of worship remain open at 50% capacity, but without an overall maximum capacity. Again, you can get this information at ramseycounty.us/coronavirus. I will turn it over to Laura Anderson and Dr. Ogawa to give an update around vaccines now that we are in our second week of vaccine clinics.
Thank you, Kathy. Madam Chair, Commissioners, County Manager O'Connor, I am very pleased to be able to provide you an update on vaccine distribution. We are finally working in a more proactive space here, and I think that's important for us to acknowledge. We have 2 vaccines that have been approved by our federal government under an EUA, Emergency Use Authorization, and they appear to be quite effective with low side effects being reported. So that is something for all of us to celebrate. So I do want to share just briefly an overview of our vaccine distribution timeline. I know we've been getting a lot of inquiries around this. Christmas week, the week of December 21st, we did go ahead and receive our first allocation of Moderna. We received 1,600 doses from our partners here at the state. That allocation was allotted to us based on our population as well as awareness of the considerable burden we've already faced associated with cases of COVID-19. The next week, we initiated all-day trainings with licensed medical personnel. This was a cross-county effort, across service teams. We're working with new vaccinators as well as individuals who have a lot of experience as injectors. Our intention here is to build internal capacity while simultaneously leaning on external partnerships with private healthcare entities who we have already been engaged with quite deeply since the beginning of this response. As of January 4th, we initiated our first series of closed clinics. These are clinics for registered healthcare personnel, EMS personnel, who have direct patient contact with individuals who may likely have COVID-19. We have so far completed 7 vaccine clinics. We've been able to vaccinate approximately 750 personnel. I know that sounds like a drop in the bucket right now, but I can guarantee that number is going to escalate quickly in the next few weeks. We've been able to initiate use of an online scheduling system called PrepMod, which will help us better judge throughput as we continue to move through this space and just alleviate some of the burden on our nurses related to the consent process for this vaccine, as well as the necessity of queuing, social distancing for the same population. So that's the 3-week timeline that we're dealing with here. It's been an adventure. And simultaneously, of course, we were notified that Ramsey County has been identified as having a few individuals in our community who have been diagnosed as having that new strain of COVID-19. So I'm going to let our medical director share a little bit more information about that now.
Madam Chair, Commissioners, they let me talk about the medical stuff, so that's why I'm the interlude. There was a new strain identified within the UK. A strain is a genetically distinct group within the same viral species. So SARS-CoV-2 has already had other viral strains, but this strain has been identified as different because specifically it contains a mutation in the spike protein that it likely, and we say likely, but it does, increase transmissibility, which as public health officials worries us because that means social interactions and any interactions at all increase that risk of passing it on to others. The data initially is looking like it increases the transmissibility by about 50%, so it just about doubles it. The new strain has been identified now here in Minnesota. There are 5 cases statewide, 2 of which have been identified within Ramsey County. The State Health Department, in conjunction with local public health, are still monitoring those cases. We're keeping a very close eye on those and interpreting where they may have been infected, as well as, given the increased transmissibility, cautioning about and being more careful about where they may have been while they were infectious as well. The good news is, I get to end on good news this time, which is really unusual, but I'm going to take it. The good news is there's no evidence at this time that shows that or suggests that this strain increases the severity of the actual infection or COVID-19. There's also no evidence to suggest that it reduces the efficacy of the 2 current vaccines that we have. So there's good news on the horizon. The current vaccines still offer, we believe, the same 95% protection against the infection. So the other good news is that the way that we are now creating vaccines allows for a quicker change if there is mutations that occur. It's called plug and play, in other words, where the genetic mutations can then be adjusted and then placed into into a new vaccine relatively quickly. So I'm going to turn it back to Laura for continuing talk of what's coming up now in terms of vaccines.
Yeah, thank you, Dr. Ogawa. Madam Chair, Commissioners, I recognize that you are receiving a lot of questions, a lot of inquiries from our constituents around when they're likely to receive this vaccine. And I have to share, we need to be very patient in this space as we move forward. We're still very much in what the state has defined as phase 1A. So we are working hard to get our healthcare personnel covered throughout the month of January, as well as individuals who are residents and staff of congregate settings. Those are the individuals who we know are most at risk of severe symptoms and potentially mortality associated with this virus. So I want to share, along with these clinics, these closed clinics for specific audiences, we have initiated some mobile strike teams in conjunction with private healthcare partners. Again, these are the partners that we've been working with throughout this COVID-19 response. We intend to work very closely with them. This includes groups like Black Nurses Rock, our colleagues at mHealth Fairview, Minnesota Community Care, Open Cities. Our federally qualified health centers have just been a great benefit to us so far and will continue necessarily to be. We are also, clearly acknowledging the support we've received from the state. There are federal and state partnerships at the table who are taking a lot of the burden around vaccinating individuals in assisted living and skilled nursing facilities. So without those private partnerships, we would be in a more challenging position. I do believe we will have an opportunity here to work to recruit additional community vaccinators. I'm excited about that partnership. I know we've been getting a lot of interest in new volunteers coming through our Medical Reserve Corps program, and I'm excited about that. For the next week, the next 2 weeks, I would imagine we will be focused on those small congregate settings, as well as private clinics for our unaffiliated clinic partners, who also provide a great deal of healthcare in our county. This is a good time for us to be building capacity and really engaging in those relationships so that we can meet the demand that we know is out there.
Madam Chair and members, just want to say thank you for listening to the update today. We'd be happy to take questions comprehensively on any of the topics coming that you may have. I wanted to just do one quick clarification question on the way in from Dr. Ogawa, if that's okay, related to the new variant, the new strain. Could you talk about, there have been 5 cases discovered, but there are likely many more across the state. Could you talk about why that is?
So I mentioned that it's a genetically different strain. So it has to actually be fully mapped in order to identify that it's different than other strains. When we do the other testing, we just sort of get a positive or a negative. And so we can't genetically test every single strain within the state. So you're right. These are the ones that we know about. MDH does spot testing and looking in certain areas, and so finds them. It's likely that we will now see more identified because it's on our radar now.
Thank you.
Yeah, it's an important point to say that they likely exist already, and that we will just be finding them out.
Thank you, Doctor. Madam Chair, we would stand for any questions that you may have.
Thank you very much. I do see Commissioner McGuire's hand has been raised for a while. I don't know if that's left over from the last time. Okay, thank you. I'll go to Commissioner McDonough.
Thank you, Chair Carter. I have 2 questions. One on the new strain. You mentioned, and it's been, talked about where the vaccine seems to be working. If someone's had COVID and they've developed the antibodies, would that work the same way, or would they be susceptible to a new strain even if they've already had COVID?
We feel at this point that the antibodies associated with getting the infection in the community will also protect them from the new strain. Although I will share with you, this new strain has not been around long enough for us to really know people being re-exposed. So and each individual's strain may also be slightly different, and it just hasn't been mapped yet. We are not recommending, or we are not saying that it is a new enough strain that people who have previously been infected will get this infection. Adding on to that, I'll mention that there have now been more cases of people being reinfected with different strains, however. And so, but it wasn't necessarily identified as this new strain.
So.
Thank you.
Yeah.
Yeah, no, I get it. Thanks, I appreciate that.
Yep.
Some self-interest in that question, because I think you're aware I've already had COVID, so there was some self-interest in that question. My second question relates to the vaccines, and I really appreciate ask for patience here and understanding as we roll this out. I had outreach this weekend from the Hmong Council of 18, who have really been taking a look at the impact in the Hmong community and kind of some of the priorities. And they've actually taken a position, and they shared it with me, and I told them I'd bring it to our folks. And I thought, I could make the call, but I thought I'd just do it here publicly. And because I know there's other folks out there too that all kind of are seeing, where do we fit into this priority? I know the CDC has done, a lot of work. The state's done some work. But the Council of 18 is really concerned about their funeral directors and the people that manage funerals within the Hmong community, because the importance of funerals within the community and how those funerals are has really put them at risk and at jeopardy. Mm-hmm. And it's really changed. And in some cases, they are really waiting for the opportunity to actually, bring conclusion to a passing of a loved one within the community because of the culture there. And so they've actually taken a position, and they wanted to at least have somebody start having some conversations or awareness of the importance in their community about funeral directors and managers of funeral homes and where they fall in that scheme, or how they could at least bring that awareness to people that are in the decision-making roles.
Madam Chair, Commissioner McDonough, I would like to answer that. I understand that MDH actually did go ahead and update their guidance so that funeral directors and other staff affiliated with funerals are included in our priority population. So I would love to touch base with you and assure that we can offer vaccine to this community partner in a timely manner.
Thank you. Madam Chair, if I could just follow up real quick. And Kathy, maybe me and you can just talk offline, because I'd like to get some information to the Council of 18 about that. But so we're in 1A right now, first responders and stuff. Where would funeral directors then fall in kind of that priority or
Yeah.
Yeah.
Commissioner McDonough, they are also they are in 1A. My understanding is that they're listed as a third priority, but that certainly doesn't prevent us from getting information to them in a timely manner, so they have a sense of what's in the vaccine and the best way for us to provide it to them. So we would like to support them in getting that vaccine before the end of January.
Excellent. Thank you. Thank you for that. Appreciate it.
Thank you. And that is good news. We'd appreciate an update when there is additional information to all of our commissioners. And thank you for getting the information out, of course, to the community and those impacted. I will go on then to Commissioner Fretham.
Mm-hmm. Thank you, Chair Carter. I have a few questions, so if you need to cut me off and go to someone else and move back, I will understand. So I have one question. With the new strain, is there any indication that the safety protocols that have been established will be modified in light of a new strain? I think right now, like, for example, for quarantining, is it not 15 minutes, it's 10 minutes, is it 6 feet, is it 10 feet now? Is there any suggestion that those will be modified?
Madam Chair, Commissioner Fretham, right now there are no indications that the actual recommendations be changed. It's, however, a perfect time for us to re-stress the importance of time of exposure and distance being still the best form of mitigation that we have. So again, we haven't seen the strain long enough to tell if 10 feet is better than 6 or if it's more transmissible if you're closer. We do know, however, that masks and 6 feet is our best option right now. So, yeah.
Great, thank you. Some of my other questions are around data. As we were going to the data dashboard and I was scrolling down, I was looking at the geographic data. And I'm wondering if there's any way, particularly where we show our cases by city, if additional data could be included that contextualizes that hard number data with the population. 50 cases in Gem Lake is certainly a lot more impactful than 50 cases in Maplewood, in terms of percentage of population, especially considering some of those cities have very small populations and some have very large populations. And then I'm also wondering, just in general, when we'll be getting, or if we'll be getting, data on vaccination progress. I think we have been doing a really good job both in Ramsey County and as a state about being really transparent about data and keeping data updated. And I think one of the things I keep hearing from folks around the vaccinations is just that no one knows really what's going on. So having an understanding of how many doses we have available, how many have been administered, how many people are in each of these categories, or even estimates of the number of people, so folks in priority 1B or priority 2 or priority 3 have some sort of idea of how much further they need to go before it'll be available. And then also just what is that uptake rate when a vaccination has been offered. I think we should know if 10% of folks who are offered a vaccine decline or 50%, because that really should be concerning to us if the number of people who should be getting vaccinated are declining, and that will really prevent us from getting to that stage of herd immunity in which we can safely reopen and people, especially those more at risk, can feel comfortable re-entering society.
Madam Chair and Commissioner Fretham, thanks for all those questions. I appreciate the recommendation to connect population size next to the cases with the city that has been recommended before, and we'll take that back to our planning and communications teams. With the vaccine doses, apologies to you because I did tell you that I would report on that today. Our incident command planning team is working with communications to work on a way to display vaccine information on our website. There is a site within the Minnesota Department of Health that you can go to right now to see vaccine administration as well as vaccine distribution. So you can at least see the numbers around Ramsey County. One thing you want to note, though, is right now you see us and hear us talk about our clinics that's with employers. So a lot of people actually reside in other counties. And so numbers may be counted in one area, but somebody lives in a different area. So just to keep that in mind. And as for uptake, I'll actually turn that over to Laura Anderson. I think she can give you a little more information about that.
Yeah, thank you, Kathy. I would be happy to. Madam Chair, Commissioner Fretham, we do have access to a tool that will help us document refusals in the future. Again, our current population of folks who are able to receive the vaccine, they are very amenable to receiving the vaccine. We have not seen a lot of refusals within this population. As time goes on, though, I think that metric is going to be very important for us to document when we move into more of a community space with vaccine. It will help us modify some of our outreach tools and processes, potentially change the sites where vaccines are given, or make other modifications in process so that we can improve uptake. We know that we need to get at least to that 70% herd immunity marker, and I think that's going to be challenging given how quickly this vaccine has been produced and within the current political environment. So we will be keeping track of that.
Thank you. And just one final question. I know that I've spoken with a few people who are frustrated that don't know kind of where they fall in the vaccination timeline, particularly dentists who are in people's mouths all day. That's a really scary very dangerous profession, and so many of our dentists are those unaffiliated clinics, and then also support staff in those healthcare environments that aren't necessarily employed by the hospital. I've heard specifically of doulas, for example, and where they fit. I guess one frustration that I've heard vented is, we've had time to plan, so why isn't this rolling out faster? And I'm just wondering if there is any factors that we just weren't able to account for in our pre-planning, or if there were unexpected differences in how things rolled out versus what we were told that we had planned for, or if someone could just talk a little bit about that, or was this, are things going to plan and it just, is taking time? I think that's also a reasonable response.
Madam Chair, Commissioner Fretham, I'll start and then I'll let others share any more specifics that they want. Yes, there's been a pandemic going on since February. There has not been a vaccination distribution plan or effort being coordinated since February, and I want to disabuse everyone of that notion here today. It's not to say that we're not going to continue to do all that we can to continue to, as rapidly as possible, roll out every vaccine dose that we receive. That is the #1 priority of public health. But this idea that we were waiting and then surprised is not how it feels on the inside of the incident management work as we've been doing it. You will see this morning that the federal government is about to again change their recommendations around who should receive vaccines. You will see this morning that the federal government is again changing their recommendations around holding back first and second doses. And you will of course know that in a change of administrations, there's been talk of ways in which some of that was going to change as well. I want to commend our folks on the ground for their work to try to sift through all of this, in addition to fighting the misinformation that shows up and the legitimate concerns from community members about taking the vaccine, coupled with everybody's human desire to get vaccinated as soon as possible. It's an extremely tough spot to be in, which is why I feel it important to share those observations from where I sit. And I would ask that as elected officials, that anything you can do to help continue to encourage people to we'll get as much good information as we can, but grace and empathy need to be in large supply, I think, in 2021 across our country and community. And I think that's going to be an important part. I'll give one last example of how it happens last second. From just knowing someone closely who is a healthcare worker, right, and was in the 1A immediate vaccination group. It's like there was a 60-hour window of notice of, hey, this is all going to be happening and you need to get in and you need to do a mass vaccination effort. And so everything is happening very quick last second, and hopefully the timelines can extend as we go forward so we can create the predictability that everyone is yearning for. I want to turn to Laura, Dr. Ogawa, or Kathy if they want to add anything.
Thank you, County Manager O'Connor. Madam Chair, Commissioner Fretham, I do understand the frustration that some of our unaffiliated clinical partners are facing, and I want to assure you that we are going to be proactively communicating with them around the decision to have a series again of private clinics that their staff are able to attend. I believe the same will be happening around those hospital staff who aren't technically healthcare workers, but have a fair amount of risk associated with their occupation. As public health servants, it is our obligation to make sure that those folks receive this vaccine in a timely manner. So again, I look forward to providing you and our colleagues some detailed information about those clinics coming very shortly.
I think it's important to take into account storage of vaccine and handling of vaccine. This is a new vaccine which comes with different recommendations than other vaccines that we have, which means there's a learning curve for everyone who touches that vaccine, who punctures the jar, and who needs to utilize that vaccine very quickly. And so I do appreciate everything that's been stated here. I appreciate the question, Commissioner Fretham, and I echo County Manager O'Connor when we ask for your help to communicate effectively with people asking questions. Thank you.
Thank you very much, Commissioner Fretham also. And I'll turn to Commissioner Matas-Castillo.
Yes, thank you, Madam Chair. I almost hate to ask this question, but it comes up is that as we move through this 1A group, do we have a sense of just how big it is? And when, you know, let's say we have all the vaccines available, when it might get to 1B, just so we can kind of help folks stay, you know, like wait till end of February, or kind of give some sense of timeline. And then my other question is, as you've mentioned, the federal government and the state has continuously changing or updating who's in that first group, making it bigger in many cases. And I know last week they announced that folks that are experiencing homelessness or their care providers or shelter workers are now in 1A. And do we have a local plan on how to administer that? Because that's a very difficult population in many cases to get connected with.
Madam Chair, Commissioner Matas-Castillo, I'd be happy to answer that question. We have great connectivity, again, based on our existing COVID-19 response with many shelters, shelter providers, and outreach staff associated with those shelters. And we recognize, again, as the guidance has changed, we have connected with those partners and are in the process of standing up opportunities for them to be vaccinated. We anticipate that this will be a long-term effort. We don't expect to see 100% of folks saying yes to the vaccine in that first round. So we're actually positioned quite well based on our existing relationships to continue to work with them and address vaccine hesitancy. In terms of the larger questions around timeline, we do have good estimates of healthcare workers who are affiliated with employers here in Ramsey County. We know where we are in terms of percentage of folks who have at least been offered vaccine. And I feel relatively confident saying that we will be in that 1B vicinity sometime in February. I would be happy to provide some details with the caveat that the timelines can change after this meeting.
Thank you very much. Commissioner Reinhardt?
Thank you, Madam Chair. I think the other question, well, there's a couple of questions that I have. The first one, I think is pretty easy or simple. Where do people go to find out which level they're in? Because I know that there's different things regarding age groups and subcategories within, as was pointed out in 1A and B and so forth. So just the more information people have, I think the better it will be as far as the anxiety over when is it possible for me to get this. So that is one question, but the biggest question that I have is we've all heard about, and if you have an iPhone, you've been asked to participate in this, the app for knowing whether or not you have been, or if you're in the vicinity of somebody that has tested positive. How in the world does it work? I said yes, and so I'm good with that. But I really, it's like, okay, is this like magic? It kind of just knows. Does it depend on how many people, I would assume, have signed up for it? So how does that app work? Because I think there are a lot of people that would be really hesitant, myself included, but did it without too much hesitation. But I think the more people are aware of how that works and any privacy that comes up, privacy data issues that come up. I mean, does it tell you the person sitting next to you? All of those things. So I know that I'm asking a lot of questions, but it all boils down to the same thing. How does it work?
Madam Chair and Commissioner Reinhardt, I'm not a Minute developer or a technology person, but I'll try to help. It does work through Bluetooth technology, and previous to the new iPhone update, there was an app that you opted into. So you needed to go to the App Store or wherever you would go to get your apps and put it on your phone. Now with the update, it automatically comes in, and I believe you say if you'd like it to be working, actively working. So it does not connect any type of personal and private information. What it does is if you have that on your phone and you have tested positive, you opt in to let it know that you've tested positive. And also, if you have been around somebody else who has the app working on their phone and you've been around them for, I believe, 15 minutes, you will get notified that someone that you have been near for that period of time had tested positive for COVID. And so no exchange of information happens. You can opt in and opt out of it. We would like people to utilize this resource because it is another way to help people understand that they've been exposed, they need to get tested, and they need to isolate if indeed they do have COVID. Does that help? Is there anything that I left out, Commissioner?
It really does help, and I think that hopefully people, especially those that maybe don't take it quite as seriously, if they put it on their phone, at least they've got some caution that comes up if they're doing things that aren't necessarily the best. I mean, as far as the masks and the 6 feet and capacity in certain locations and so forth. Because the fact of the matter is, even if you go into a setting, and I know I've had some concerns about this myself, is I can do everything that I'm supposed to be doing, but if the person next to me isn't, it doesn't matter. And so having this app, and now that it does make me feel more comfortable with it. As I said, there was no real hesitation on doing it other than I wonder how it works. But I'm glad to know really kind of more of the logistics of it. And I think it's going to be important for people to understand that it really is for you, a protection for you. And knowing whether or not you need to get tested. I also wanted to point out, I know Deputy County Manager Hadeen, you had stated before that you can get a saliva test, and that people should go ahead and order it, not wait until they think they have been exposed and then go, oh, I better order it now. And so it's very easy to do. I took your advice. Both my husband and I have one. So if there's a time where we feel like we need to take it, we're ready to go. It was very simple to do, and so I would encourage folks to do both the app, especially on the iPhone. It's so simple. You go, yes, but also to get that one free saliva test, and if you need it, you've got it available to you. So thank you very much.
Thank you.
Oh, and then the question that I had asked about the where do you go to figure out where you're at in the 1As, Bs, whatever it is, within the subcategories as well? Is that at MDH?
Yes, I can answer that, Commissioner Reinhardt. So my recommendation currently would be to check out MDH's website. They do have a listing of priority populations. They are still very focused on priority 1A, I have to warn you. My understanding is that the criteria for 1B will be released, I believe, later this week, and that will be a useful source of information for many of us as we try to assess where we fall in the Minnesota priority matrix.
Well, and I think that that's fine. It's just having the information. It's not whether it's, tomorrow or 2 months from now or whenever it is, but having the information can help quell some of the fears that are out there. So thank you.
And thank you very much, Commissioner. I want to just stop on that one. I had the same question, and just to extend it a bit further, not to go too far into the weeds, hopefully, I am wondering what we may know about the uptake on the application. And of course, as Commissioner Reinhardt said, it only works if people are using it. And what we might be doing to encourage that use, i.e. upon testing and notification of test results, if we're referring people to voluntarily include themselves on the app. And are we hearing back from people who have come in for testing because they have been informed by the app? Are we getting information about that? Do you know?
Madam Chair, those are great questions. I do believe uptake was low, which is why it's been pushed out. And I actually think it was a brilliant idea to put it in the iOS update. It puts it right in front of you the moment your phone is reset. And so what I don't know and what we can learn and figure out are the details of any notifications that have been made. I think I've had the app on my phone for a couple of months since it came out, and maybe it's longer than that. I have not been notified of being around anyone, but that also could be indicative of where I go and where I don't go. With that said, we could grab information and share that with all of you.
No, it'd be wonderful to know that it is being used. I just put it on, in fact, a couple of days ago, but that's also an indicator of where I've been, and I have not been around a whole lot of people to be exposed for sure. The other question that I have is about the congregate settings being prioritized as part of 1A. And I know we've asked this question in the past. I don't know if the information is settled yet, but does that include, it does include, I'm assuming, our shelters, our correctional facilities as well. Is that correct?
Madam Chair, so homeless shelters are included in priority 1A. Correctional facilities are high on the list for 1B. So stay tuned. We will be moving, we're already communicating very closely through our correctional health nurses. We will absolutely move on those populations as soon as we can.
I appreciate hearing that because, of course, that is a high risk for spread area, and we want to be sure that we're including those individuals, both our employees, our healthcare providers who likely are already included because of that category, but to make certain that employees and also residents in those facilities are covered.
Madam Chair.
Thank you for keeping us informed.
If I could add to that, I think I would like to highlight the work of Dr. Ogawa and Dr. Van Franken and Michelle Dean, who runs the correctional health within our facilities. That our rates within the jail facilities have been low because of the work that they have all done to have a process and a protocol for isolating and quarantine, and to make sure that people get tested multiple times as they come into our jail facility. So I do want to commend them for their work. I do think we are a bit of an anomaly compared to the other jail settings across the state, and it really has a lot to do with their leadership in this space.
Thank you so much for pointing that out, and we have observed that active work, of course, throughout the course of this exposure. Thank you so much for that, and to all of our staff. I think I have neglected that Commissioner McGuire has raised her hand. Commissioner McGuire?
Thank you, Madam Chair. You didn't neglect it, but I added it a little bit late. All these great questions of my colleagues have spurred on some questions of my own, and now this last set that you just asked, I'm going to follow up with that before I ask my other questions, but thank you so much. So remind me who sets those distinctions? Like, it would seem to me that the correctional facilities are congregate care facilities. I mean, that they should be in the 1A. Is that set by our state or our federal government? I don't know that there's anything we can do about them, and I so appreciate the work that our staff has done to really limit the exposure in our facilities. Could you just remind me who sets those? Is it state or federal?
Yeah. Commissioner McGuire, so our State Department of Health is working alongside an advisory body that is made up of healthcare professionals, infectious disease experts, and community members as well, to identify those criteria. And we do lean back as well on federal criteria, which you have seen. Certainly the CDC has come out with some definitions around 1B, and then Minnesota takes a turn and looks at those criteria and makes further decisions based on local priorities. But I do agree with you. I think that these facilities are certainly in need of vaccine as soon as we can provide it.
I appreciate that. Thank you for reminding me about that process. And then now, Madam Chair, I have a couple of other questions prompted by Commissioner Reinhardt's questions. I woke up this morning and I got a note on my phone about, do I want to share or do I want to know information about spread of virus? And I had already, like when the governor first came out that day, I actually got the COVID Aware app on my phone. I put it right on right away and said yes, yes, yes to everything because I wanted to help with that. And then today was the first day that I got a notice, and it wasn't to tell me that anybody had tested positive near me, I don't think, but it was just interesting that that came out today. And so I don't know if you want to just comment on what that is. So now I just went back in my app, and I think I had it, I don't know, I wanted to make sure that I was already signed up. So I re-signed up, I think. So if you know any more about this, just if other people are getting the same notice.
Yeah, so Commissioner McGuire, when your iPhone goes through an update, I would imagine the app pushes out another assent or a consent so that you are able to again agree to share your information for purposes of notification. So I would imagine that's what happened to you this morning.
Thank you. It was just interesting because, you know, I first saw it and I was like, oh my gosh, I haven't been anywhere. Who would I have even got it from, you know? So, or who would I have even been exposed from? Not got it, but exposed to. So it wasn't that I was exposed. It was asking me for a affirmation. Thank you for that. That makes some sense. I have another question now about the, you know, my family does Zoom calls like so many other families, and unfortunately members of my family have had it. We're all trying to be as safe as possible, but then what's been going around now is, well, you should get tested for the antibodies. And I can't remember if we've talked about this before, but I said, well, why would I get tested for antibodies? You know, I should still be careful. I should still do everything. It's not conclusive. And so we have these discussions, and I'm guessing that other people may. And I guess there's a test you can take for, you know, it costs money. I mean, it's not something that our healthcare providers provide, but I guess you can go to a place in the cities where you can get your antibodies tested. Could you just comment a little bit about that? I have, you know, some of my family members have done it, and some, and I haven't yet, but could you just talk about that?
Sure. Madam Chair, Commissioner McGuire, I'll take this one. So there is an antibody test. It's a blood test. And so what it does is it looks specifically for whether or not your body has been exposed to the virus and has, this is where it's important, circulating antibodies against COVID. The reason that I talk about circulating antibodies is that we know that the body's immune response to this virus is not just antibody, but is also T-cell, B-cell related. It's a complex immunologic response. We also know that antibodies fade, circulating antibodies fade after anywhere from 3 months, 90 days to 6 months. We're not 100% sure. We don't believe that circulating antibodies are necessarily the best indication of whether or not you are truly protected. And so it is a potentially poorly interpreted test. And in medicine, we strongly discourage poorly interpretable tests. It can give you the false sense of being protected and the false sense of not being protected, both. And so that's why we don't recommend it. In the beginning of the pandemic, we looked to antibody testing because in other diseases and specifically in other infectious diseases, antibody response has given us better information. But that's in cases where the disease was clearly antibodies were protective. In this case, it's not the same. So that's a very long answer to it's still not recommended because it's difficult to interpret and whether or not it truly offers you protection. We actually are finding more now that perhaps people who have had the disease but don't have circulating antibodies still have some level of protection, though, within their B cells and T cells. And so that's the other reason why we're wanting to ensure vaccination as a way of knowing people are protected.
I really appreciate that. Thank you so much. That affirms what the medical professionals in my family have been saying as well. So it's not them that have been encouraging the antibodies, it's the other members. So good. Thank you for that. Thank you for that affirmation. And thank you, Madam Chair. I really appreciate all of this update. You're all doing such great work. Just thank you so much.
Thank you. And it's interesting to learn that even within families, we don't always listen to the professionals, and of course we should. We really appreciate all of the professional information that's been brought before us this morning, all that you were doing, working with partners and addressing the priorities as we understand them in the process of working to get us beyond this crisis. I want to make certain to turn back to the county manager or to any of our professionals for final comments as we move on in our meeting.
Madam Chair and Commissioners, thank you so much for the great questions today. I think it was helpful for you all and for those who are listening to have those questions asked. Final information is there's a great graphic on our website at ramseycounty.us/coronavirus, and you click on the COVID-19 vaccine information. The graphic shows who the populations are to be vaccinated in each of the phases. It's very simple to look at and understand, and you can go there to get up-to-date vaccine information as well. Thank you.
Thank you very, very much to all of you. Checking in with County Manager O'Connor before we move on.
Nothing else from me, Madam Chair. Thanks to everyone for that update.
Great. Then we will quickly repeat our moment of silence, given the health and economic and social and political turmoil that we have seen and are enduring through. We want to continue to have our moment of silence to reflect on, to be thankful for, and to continue looking forward toward that bright light. A moment of silence, please. Thank you very much. I hope that all of us here in the meeting and those who are watching take advantage of that moment for a deep breath of preparation and calm as we continue to address the many issues before us, and thankful for all of the partnerships and personnel who are working together to ensure that we are taking the right next steps forward. I want to turn then back to Commissioner Ortega for our administrative agenda.
Thank you, Madam Chair. I'd like to move, excuse me, I'd like to move item number 4, salary schedule and grade allocation for 2 new classified unrepresented job classifications. Item number 5, waiver of variable pass through for the Minnesota Burn Justice Assistance Grants Criminal and Juvenile Justice Intervention Grant Program. Item number 6, First Amendment to the lease with Face-to-Face Health and Community Services, Inc. Item number 7, cooperative agreement with City of Shoreview for Lake Owasso County Park. Item number 8, Metro Gold Line Bus Rapid Transit Project Financial Commitment. Item number 9, funding for the COVID-19 contingency account in 2021. Item number 10, funding for the Ramsey County Community Homelessness Response. Item number 11, reports of contracts, grants, and revenue agreements. Item 12, summary of the conclusions from the performance evaluation of the county manager. Thank you, Madam Chair.
Thank you, Commissioner Ortega. Is there a second? Second. Thank you very much. There is a motion and a second on the administrative agenda in its entirety. Is there any discussion? Will our clerk please call the roll?
Ortega?
Aye.
Reinhardt?
Aye.
Fretham?
Aye.
Mas Castillo?
Aye.
McDonough?
Aye.
McGuire?
Aye.
Carter?
Aye. Thank you very much. The entire administrative agenda has now passed, and we are on item number 12, which is ordinance procedures. We have before us the proposed Housing Stability Department ordinance. We have seen information prior. We have conducted our public hearings, and we are now, or we have had both readings, and we are now in the process also of adopting the proposed Housing Stability Department ordinance. Is there a motion?
Madam Chair, I'd like to adopt the proposal for the Housing Stability Department and ordinance.
Thank you very much. Thank you for the motion and the second. And is there any discussion? We appreciate that we've had the opportunity to hear this before us and have had the opportunity to share with community and now to vote on the ordinance. With the clerk, please call the roll.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Carter,
Aye. Thank you very much. The Housing Stability Department ordinance has now passed. Congratulations to commissioners, to our staff for the work that has been done, and to our community for the opportunity for this new Housing Stability Department to help us address the continuum of need that exists across our community, from shelter to affordable housing in this area. Thank you very much for your work. And on to County Connections. County Manager.
Thank you, Madam Chair. Members, she just snuck out, but I'm going to do the update anyway, and hopefully she can hear it from outside. So as I came in today, I had a copy of the 2020 Minnesota African American Heritage Calendar for the coming year, and I see she is still here, which is great. And I looked at the calendar this morning, and I found my way to the month of October. And for the month of October, I wanted to highlight that our very own Deputy County Manager, Kathy Hadeen, is being honored as the Minnesota African American Heritage Calendar Leader of the month of October for 2021. And there's a huge bio in the calendar for you. And I'm going to see if we can get calendars for everybody here on the board. And I wanted to celebrate and commend Kathy for that. And thanks for coming back up, Kathy. It's an honor to work alongside you. And anything else you would like to share while you're here?
Well, thank you, County Manager O'Connor. I had no idea that was going to be presented today. You know, it was an honor when I got the call and asked and told that I would be honored to be in this calendar. I'm sitting alongside many amazing people, including our board chair, Ms. Tony Carter. So it's an honor to be in the presence of amazing leaders who are in our community, who are leaders for me to look up to, and for others who are young and, not suggesting I'm young, for younger people, to have role models and people to look up to in our professional space here in Ramsey County and in Minnesota. So thank you, I appreciate it.
Thanks, Kathy. We would also like to make an introduction, Madam Chair, and I'm going to turn it over to John Kelly to say a few words about our new Civil Division Director. And welcome, Sam Clark. Please come on up, and I'll turn it over to Mr. Kelly.
Thank you, County Manager O'Connor. Madam Chair, members of the board, very happy to be able to introduce Sam Clark, who will be the new Division Director.
Sam, before you're finished, I'd just like to ask if we can see Sam. Don't see him on the camera.
We can, so I think you'll get there in just a sec. Sorry, Madam Chair. We had a mic off, so I'll go back to Mr. Kelly, and we'll find our way back to Sam.
Yeah.
That's fantastic. I'm sorry to interrupt, but I wanted to make sure we were able to see Sam before he's done. And with that said, we'll turn it back over to you.
Thank you, Madam Chair, members of the board. I thank you to County Manager O'Connor for saving me from my. I'm in the board chambers today, and I made my failed to turn my microphone on, so it's that version of you're on mute for me. Third time this year. So anyways, I'm very happy to have this opportunity to introduce all of you to someone you probably already know, and that is Sam Clark, our new Civil Division Director. We are beyond happy to have Sam join us, and we appreciate the time today just to give Sam a few moments to reintroduce himself and maybe introduce himself to some who've not had the pleasure of having met him previously. So thank you.
You're on, Sam.
All right. Well, I hope you all can hear me and see me eventually. I'll be brief. I know these meetings, no one ever comes to hear the new guy. I wanted to first express my excitement to be back in public service. As John mentioned, I'm Sam Clark. I am a proud District 4 resident, although I did spend some time residing in Districts 3 and 5 as well, so shout outs to 3 and 5. And it occurred to me while sitting and watching the meeting today, this is kind of the third stage of my life where I'm kind of rooted in the work that happens in this building. The first was growing up the son of a Ramsey County judge here, running around up on the 14th floor. I was smaller, I had full head of hair. But that experience, growing up in Rondo, the son of a judge who was one of a small handful of black judges in the state, really shaped my thinking about both the opportunities for advancing rights of others and opening opportunities, but also got me thinking at an early age about some of my friends in institutions like Cretin-Derham Hall as a high school kid would get in trouble with law enforcement and they'd be fine. Other of my friends who I grew up with playing around the fields of Jimmy Lee and MLK, they'd get in trouble and they wouldn't be fine. They'd fall into a system and they'd never get out. So the second stage of my life was as the St. Paul City Attorney. So I spent a lot of time in this very room with a different level of government, working on expanding opportunities and really making that promise more of a reality for so many of our fellow residents. And then now I'm back, and I just want to thank John Choi for selecting me for this position. I went through an interview process that did include the county manager and John Kelly and others. And I look forward to working with you all on the commission. I think my experience is varied throughout government and private public sector, but one thing I do know as attorneys is, or I should say one philosophy I have is it's not our job to tell you all no. We're here to work with you, and best we can do is tell you what the speed limit is and what the risks are with breaking the speed limit, but it should be a rare moment when you hear from me or the folks I'm going to be working with, no, we can't do that. So I'll be reaching out to all of you, I'm sure, trying to sit down with you all to hear about what you're working on. But I just want to express excitement and gratefulness to be back in public service.
Thanks, Sam, for that introduction, and welcome to Ramsey County. We're thrilled to have you here, and you'll be pleased to know that I have yet to receive a speeding ticket, so I will adhere to whatever speed limits we set as we go forward together. Thank you. Madam Chair, one last announcement, connection piece. We recently posted on ramseycounty.us/racial equity. So on the racial equity page on the website, an updated report that was completed late last year from the Equity Action Circle, who works directly with the Racial Equity Community Engagement Response Team, on recommendations for Ramsey County as we think about how to continue to drive racial equity beyond words into action throughout our organization. This was a report written by community members. It was facilitated by the Racial and Health Equity Administrators, and I want to thank them for their dogged efforts in this space and for their work to then ensure that we had an opportunity to take that information and share it back across the organization. I think we get asked a lot in going into budget cycles or at any other time, how are we integrating community voice into our work? This would be one of those important pieces to building that along the way. And so that report is now up and available online. I wanted to highlight that for you and anyone else watching today. There are a ton of recommendations in there. You will see that some are short-term, some have already been implemented, some are mid-term, some are long-term, some are very tangible and tactical, others are ambitious and strategic. And it is in that mix of all of it where we set agendas together and move our work together. So thanks to Sarah and Prince specifically for their work at the outset in this work, and then Mi Cheng for joining and being a part of bringing the report to fruition, for the work of our departments to debrief and download and understand where the information came from. And now the hard work will continue in the weeks and months ahead, and we look forward to using that report as a guiding piece of our continued relationship building and work together. The EAC has been meeting with different operational units of the organization to talk through those recommendations so that they don't become community recommendations here and departmental initiatives here. It becomes collective work together that we move forward on. With that, Madam Chair, I would stand for any final questions any of you may have. And before we move on, I would just highlight as well for you, because our two agendas had a little discrepancy, we didn't do a legislative update yet, and I just wanted to catch that as a final word in County Connections. Thank you.
Thank you very much. And while I look to see if others have questions, I just want to thank you for such good news updates in all three areas. A big, big congratulations to Kathy Heding, who is being honored, and a request that she let us know the date of the program to honor her. I know that we're in COVID-19, it may be virtual at this time, but whatever the case may be, we'd love the opportunity to be able to join in on that celebration. Welcome certainly to Sam Clark, who we look forward to seeing again in the halls as we move forward, and also in our meetings as well, and the opportunity to check in with him on getting direction and understanding the limitations that we have, but gaining assistance. And also, thank you very much for highlighting the Equity Action Circle recommendations that are on our website. We appreciate knowing that the community has been assisted to learn about and to make recommendations in areas of Ramsey County's business on behalf of community. And this is so representative of what we are doing in working not just for, but also with our community toward those solutions that address our needs and opportunities. We look forward to hearing more about the manner in which those recommendations are helping to set the agenda and to advance our planning. Thank you once again very much. I see no further questions coming from the Board of Commissioners. We so appreciate the county connections. And we're moving on then to our board and committee reports. I will start that out with Commissioner Reinhardt, and then we'll move back around through the alphabet to Commissioner Ortega to wrap us up. And as we move forward, we will also ask that Commissioner McGuire address the legislative work that is in process. Thank you so very much. So I will turn to Commissioner Reinhardt.
Thank you. Actually, I'm just going to do a very short update. The Minnesota Geospatial Advisory Committee, which I am on, did its goal setting for 2021. And one of the things that I talked about is, and actually at the National Association of Counties level as well, on the IT committee, is the importance of the underlying data. Geospatial data, I said I really believe that the GIS community is probably the most humble community of workers that I have ever met. They just get the job done, and the information, the data appears to us somewhat magically, it seems like. But one of the things that is truly a cornerstone is the remonumentation, making sure that we've got the correct corners and different data points that are included. Some of them have been around for 100 years or more. And so trying to make sure that we've got that base data is incredibly important, and it's something that again, I think is kind of taken for granted. So I try to raise that awareness, you know, what we do and how GPS works, how geospatial data works, is really critical, and having that base is important as well. So trying to raise that up a little bit. That does lead into the IT committee for the National Association of Counties, and that talking about cybersecurity and also in relationship to what has happened. I expect that the chair will talk a little bit about the insurrection and what happened at our U.S. Capitol and how unbelievable, but also awareness raising and the work that we need to do and the work that we've begun here, how important that is right now. But there's also the side of that that is in the cybersecurity area that we really need to raise up, because there can be a lot of damage that is done to our community, to our processes, to our economy based on cybersecurity. It's very encouraging to see what is happening at the national level and through the National Association of Counties, who has taken this on before that, even as a very serious issue. And so one of the things that, and I'll end with this, one of the things that was stated was that even if, you know, in the most recent security concerns that were raised, even if you think that you've got everything covered, it's worth going back and double checking. So I will leave it with that, and we just have to continue on the path that we are, I believe, in Ramsey County regarding diversity, inclusion, and really working with our community members, because that's what it all comes down to, is communication and working with people to get the best outcomes for all in our community. Thank you, Madam Chair.
Thank you, Commissioner, and thank you also for that brief update. Important but brief. I should note that we do have regional rail following and also a workshop, and so we'll continue with our brief updates. Moving on then to Commissioner Fretham.
Thank you, Chair Carter. I will try to keep everything brief, but I think it is really important, even if it seems obvious, to say unambiguously that the attempted coup at the U.S. Capitol that occurred last week was unacceptable. Now, we cannot move forward until those who are responsible are held accountable, and that means not only those individuals who desecrated the Capitol and threatened elected leaders, but also those who encouraged it, both explicitly and implicitly by their repeated lies and disingenuous questioning of our election process. And I just want to reiterate how immensely proud I am of the work done by our election staff to ensure a safe and fair election in the midst of a pandemic and an atmosphere of social upheaval. And that this election has really shined a spotlight on our election systems, which are run at the local county level across the country, each with independent oversight from their county boards, and how this local method really protects the integrity of that system. It's not a perfect system, but nothing is perfect. None of us are perfect. People in general aren't perfect, and our government, both as an institution with its own identity, but also one just composed of people, is not perfect. And it feels like this week or last week, we lost sight of the first stated goal of our Constitution, which is that the goal to form a more perfect union, that we need to continue striving for that. And when we do that, we really fail as a country. So I hope for unity, but first I hope for accountability, reflection, and reclamation of those fundamental values. So thank you.
Thank you very much. Again, brief and critical. I will move on to Commissioner Matos-Castillo.
Yes, thank you, Madam Chair. And if I may just add to Commissioner Fretham's comments, because of the unrest, the insurrection at our national capital, and ongoing tensions here locally, I just also encourage us all to take a pause and check in with each other, check in with our kids and our neighbors, and it's impacting communities very differently in our Black community and our communities of color and what that looks like. And so I just encourage us all to also just take a pause and check in on each other, because it is a very frightening time for many, and in the coming days that we just need to be vigilant and really care for one another. Two quick updates as well. Great River Rail, which is formerly known as the second train to and from Chicago. I want to remind folks that we did receive the federal grant that we had worked on for many, many years last fall, and we have a year, essentially, give or take, to demonstrate progress toward meeting the Minnesota match, which is $10 million. And so I do serve on the Great River Rail Commission representing our board, but just want you to know that we are working very actively to make sure that this happens this year, so that we really can bring that second line in. It both benefits passenger and freight rail as we do that, and so I appreciate all the partnerships, but you'll be hearing a lot more, especially this year, on that Great River Rail, because we have to get it done, and we need to get it done this year to make sure that we maintain that funding. The second thing is the Rice Street study continues. We've got great work and proposal presented from community input on the expansion of protected bikeways, more green space, and wider sidewalks, which is really important for that essential corridor throughout Ramsey County down along Rice Street, in addition to our partnership with the Met Council on the potential for an ABRT line on Rice Street. So just want to encourage people to go to the Rice Street study page and continue to give feedback at ramseycounty.us, Rice Street study. Thank you.
Thank you very much, Commissioner Castillo. Commissioner McDonough.
Thanks, Madam Chair. No report.
Appreciation, Commissioner. Commissioner McGuire.
Okay, good. I appreciate getting the opportunity, Madam Chair. I'm just going to give my update, then I'll give the legislative update, because I just want to echo Commissioner Matis Castillo's encouragement to go on the Rice Street study. That is really important that we get a lot of feedback on that, and that we're in line. We're in the tier of groups considered for that, and so it will really matter if people contribute to that. And also want to follow up on Commissioner Fretham's comments about the events last week that shook our democracy, and just that it was felt throughout the community. Almost every meeting that I went to, we talked about it. I was in Rotary Book Club. I was in Optimist Luncheon. It was the topic of conversation. So the community is really reeling from it and wondering what we can all do. And I just know that we all stand by to do whatever we can to really reinforce our democracy and make sure that the things that we're doing help with that. So also want to say that the Child Care Policy Action Group met, and this is Commissioner Fretham is very involved in this. She's actually on the subcommittee on gaps, which we heard a great report from Kristen Poffenberger, and I want to give a shout out to her and that group for putting together a great gaps study at our group. We're going to meet about every 3 weeks now, just to give us time to gather data in between meetings. But we have great community involvement. We have these amazing meetings with like 20 people on the call of all nonprofits and levels of government, school districts, and in counties. And we are just moving forward on how we're going to address our child care needs moving forward. Also, I have to just give a shout out to NAMI, the National Alliance for the Mentally Ill. They're doing a great introduction to mental health advocacy, and I listened to it last night, and they're doing a series of these, but it was all about the history of mental illness in our state and country, and it's pretty phenomenal. If ever you get a chance to listen to that, it was pretty amazing. Also, our AMC is having our first board meeting this Friday morning, and so I just want to remind people about that. It's at 9 o'clock till noon, AMC board meeting. And now, Madam Chair, with your indulgence, I'll give the legislative report, which is, first of all, to thank our team. We have been meeting all year. We met all year, as you know, and we're just continuing now, of course, because the legislative session has started. So thanks to Jennifer O'Rourke and Melissa Finnegan, our government relations team, and then Commissioner Matis Castillo, and myself, and Ethan Ostin and Melissa Jamrock. We meet every week and talk all about what's going on at the legislature, and there is always a lot. The committees have started meeting. There's many, many, many hearings all happening concurrently, or many happening, not all of them, but many happening concurrently. So you may get a notice from our government relations staff to listen in on a hearing if they're not able to cover it, if it's a topic that we think we should be listening to. Since these meetings are virtual, many of them, or most of them, I think, except the Senate might be doing some in-person ones, not sure. But just to know that we're trying to cover all of the topics in these committees. About a third of the committees will have COVID-related topics or CARES funding updates. So that's always important and interesting to listen to. Chair Carter will be testifying on behalf of our CARES spending in the Property Tax Committee this week, and we want to thank you, Commissioner Carter, for your time there, and also all of you. We know that we're all called on many times to testify, and we, of course, appreciate that time that we can do. Representative McCollum has invited us for a short meeting this Thursday morning. I believe it's on all of your calendars. That will be, hopefully that will be taking place. We'll see what's happening in Washington if she's able to keep that meeting, but she's anxious to talk to us about what's going on within Ramsey County and what's happening in Washington, and we really look forward to that meeting and appreciate that she's wanting to give us that time. And then the last thing I'm going to talk about is our Ramsey County delegation meeting, which did get rescheduled till 3 o'clock on Friday. I mentioned it last week, but this week it's going to be at 3 o'clock. This was to accommodate legislative schedules and our own. So we are all invited. It will be posted, and we have staff that will be there. This is a House and Senate delegation meeting that will be in conjunction with Representative Jamie Becker-Finn and Senator Kunish. They are going to be starting the meeting, but then it really will be Ramsey County's meeting. So look forward to that, and hope I anticipate that most of you will be able to be there. So that will be on Friday at 3. Thank you, Madam Chair. That concludes my report.
And thank you very much, Commissioner McGuire. And I'll turn to Commissioner Ortega.
Thank you, Madam Chair. First of all, let me echo my concerns of my colleagues in terms of the national, what's going on at the national level, but I am positive and we'll get through it. I just want to thank, we had a very good meeting with the Mayor Carter and city staff last week regarding the River's Edge and how we are going to work together to advocate in terms of any assistance, partnership with the state regarding River's Edge. As everybody knows, the public realm is our vision for that development of our West Publishing site, former West Publishing site. It was a very good meeting. The city staff was there, our staff, Jennifer and Josh and Carrie. We had a very long meeting. It was close to an hour meeting, and we really came up with some good strategies, and we're going to talk further. But again, we need to work hand in hand with the city and the city with us to get these big projects done, because we have a window, and once that window is gone, there's no turning back on some of these projects. I'll keep it there, Madam Chair, in the interest of time. Thank you very much.
Thank you very much, Commissioner. With all my going back and on mute, off, I'm turning camera on and off, so forgive me for that. I just want to share a few thoughts as well in connection to those that have been shared by all of you, and I'll make it very brief. I believe our town hall with Sisters of St. Joseph's of Carondelet was after our last board meeting, and it was an excellent opportunity to hear a YIMBY, yes, in my backyard response, and all sorts of methods of assistance that were discussed as a part of that meeting. I just wanted to let you know that we are continuing to work with the community, of course, with Interfaith and with the sisters as we move forward in advancing a family shelter for 20 families in that location. I also had the opportunity to participate with the City of St. Paul in the Community First Public Safety meeting last week. We heard at that meeting from Nancy Pass, who is the director of our Ramsey County Emergency Communication Center. It was a great opportunity to hear from her, along with Matt Tupol of St. Paul Police Department, the director of operations, the need for a response, an alternative, and multi-tools response to level 4 and 5 911 calls as ranked by the St. Paul Police Department. This is an opportunity for 50% of the calls received that are about responses or that are about incidences that could be responded to by others in our community, by others in our systems, to actually relieve police officers so that they can focus on the higher level priority calls. We'll be continuing that work, and a community of participants are charged with making specific responses to the mayor and city council within the next few months. I'll share additional information about that as it moves forward. A number of commissioners have mentioned our concern and chagrin with the great challenge to our democracy this past week. And certainly all of us are saddened and grieve the loss of a sense of great security in the democracy that has been built here. Yet we know that we will sustain our support of that democracy and that we will be victorious nationally and certainly here in Minnesota and locally within our communities. We do know that the impact was not just to the national, but also to all of us, all of the people in our communities and in our staff as well. And I want to say thank you to those in Ramsey County who remain focused even through their own chagrin on delivering services and making the work possible for all of our community. Thank you to our leadership who are supporting each member of the Ramsey County team to do their very best work, not just even during, but especially during this time when we must bolster and support those in our community who need us even more than before. And I want to give confidence, as I have been sharing with the county manager, of course, our concern, the county manager has been sharing with me the work that we in Minnesota and in our local communities have been doing. It may be that we were caught off guard at a national level this past week to assure us that we are meeting and collaborating and continuing to monitor and to plan to prevent incidents here and to protect all of us. That work is continuing. Our level of heightened response has been ongoing as we worked together last year beyond the critical social unrest that we saw here in Minnesota. We are continuing to do so. So I want to thank those in the county manager's office and Homeland Security for the work of our public safety and law enforcement teams who are coordinating together to ensure our preparation to move beyond and to a space where we have assured within our local community that we are safe, that we are prepared, that we are able together as a community to move positively forward. So I just want to say thank you to all for that work. Enough said. We are moving toward a regional rail meeting, and after that to a workshop, which will be on hazardous waste services. Commissioner McGuire will conduct the workshop immediately following our regional rail meeting, which will be convened by Commissioner Ortega immediately following this meeting. And with that, we are adjourned.